Well, think about this. In 37 states, it's legal to deny women health insurance simply because they're women. And according to Prevention Magazine, 95% of insurance companies that offered individual health plans practicing gender rating or gender-related denials.
Joining us now is Diane Salvatore, editor-in-chief of Prevention Magazine, along with Dr. Phillips. And ladies, I got to tell you, being a female reading this not only was frustrating, but a bit shocking. Diane, let me start with you because your report, you say women can pay up to as much as 84% more than men when it comes to. Why is that?
You know, it's really shocking when you tell people it's called gender rating. Men pay less, women pay more, and it's because women actually are using healthcare services more frequently, and we at Prevention feel that women should be actually rewarded and applauded for using healthcare services, not
because
penalized.
Doesn't it help you catch disease ahead of time so that there's less cost when it comes to treatment?
It sure does. I mean, not only is this a practice legal and rampant, but we think it's outrageous for exactly that reason. Not only does it lower healthcare costs for the whole system overall, if you're going, you know, it's lots of body parts, so little time, but it actually saves lives. And at Prevention, that's what we really think is important.
So when you're investigating something like this, are those the explanations that you're actually given? Well, you know, women use their medical benefits a lot more than men, so we need to try.
Well,
I mean, can someone actually give you that explanation?
Health insurance companies, first of all, don't have to tell you why you're being denied. But when you ask them, the health insurance companies are unapologetic about that. They say it's good business practice.
So, Dr. Hawley, I was going to ask you, how does it affect the patient on that end of this?
Well, that's the irony of the whole thing. Really, the more you see the doctor, women tend to see the doctor earlier and at younger ages, so they catch things earlier. They have prevention, they have early detection, and early treatment, which ironically saves the insurer money. The insurer should want people to get into the doctor early.
That's right, because having a quadruple bypass is a lot more expensive than it is to go every year.
And certainly almost all cancers, if they're caught in stage 1, it's a fraction of the cost to treat someone then than if you wait until they're stage 4.
Are you surprised that this is even legal?
We are. Everybody that we tell about this is shocked, and they can't believe that it's America in 2011. And in fact, if you go back to the 60s, health insurance companies actually self-regulated. They used to charge more based on race. They don't anymore. And we at Prevention believe that health insurance companies should step up and change their practices now.
What has the response been, first of all? And how long, I mean, I know you mentioned back in the 60s, how long has this been going on where you've seen, you know, as much as 84% more? This is a drastic increase.
It's been going on for decades, and more Americans are at risk as companies charge more and people are out of work, and you have to have individual health insurance policies.
So what do the companies say when you do approach them? I mean, Holly, what do you think the response would be?
Well, you know what? I think the way to approach companies is to know that you are the person with the power. You can shop around. You can take your money elsewhere, and that forces these companies to be competitive with one another. You know, if you threaten to take your business elsewhere, they will more likely capitulate and do something for you.
Well, and the first thing you have to know is if you're in one of the 13 states where it is illegal to do gender rating and you still feel that you've been denied or charged more, you can go to your health insurance state commission and make a case. You also want group coverage as much as possible. So if you suddenly, you know, had health insurance, you don't, make sure you're on your partner, your husband's group plan. And some trades and professions have group plans, you know, if you're a lawyer or a teacher or a mechanic. You know, lastly, the Affordable Health Care Act is to go into effect in 2014, but between now and then, this can still happen to you. And so let your state representative know that you want that act not to be taken apart. There's political opposition to it.
So you got to do a little homework with this, make sure you're protected.
There are no guarantees.
Not at all.
Ladies, thank you both very much. We appreciate it.